This is She's on Call, a weekly show hosted by ENT specialist Dr. Sujana Chandrasekhar and General Surgeon Dr. Marina Kurian. They'll be joined by guest experts to discuss an array of newsworthy medical and health issues. You're invited to ask the doctors anything. The physicians and their guests' views are their own and do not represent any institution. Please contact your doctor for any personal questions. Please hit share and join us live on Facebook, Twitter, and YouTube at She's on Call, hashtag She's on Call. Please welcome our hosts.
Hello, I'm Dr. Sujana Chandrasekhar. I'm an ear, nose, and throat surgeon with practices in New York City and Wayne, New Jersey.
And I'm Marina Kurian. I'm a general and minimally invasive surgeon in New York City. And this is our 51st show. We've been off for the month. We did a show in July, but it's been 4 weeks, so insane. But now we're back and we have a great show lined up, right, Suj?
Yeah, first of all, I've missed you a lot, Marina, and I'm happy to see you again. It is August and schools are reopening here in the United States. Today's guests are going to talk to us about how we do that safely, how we educate our children safely and effectively. They are Dr. Michelle Fiscus, who is board member of the American Academy of Pediatrics, and until recently was the Tennessee Vaccine Preventable Diseases and Immunization Program Medical Director, and Dr. Linda Mendonca. She is the president of the National Association of School Nurses. She's based in Rhode Island and is assistant professor of community and public health nursing at the Rhode Island College School of Nursing. And you know, Marina, we all have questions about how we send our children safely back to school, whether it's preschool, elementary, high school, or college.
Absolutely. My kids are going back to college, and I think both their institutions have mandated that if they're doing in-person classes, which they are, that the students should be vaccinated. I'm not sure if some of the schools I noticed were saying you have to test weekly if you're planning on attending without a vaccine, but other schools are doing at colleges are doing 100% vaccine if you're going to be in person. So it's interesting. And, you know, hopefully that'll help curtail a lot of the COVID that we've been seeing and talking about for 14 months now.
My God. I know, I really wish we could start the show not talking about COVID, right? We have, you know, for children in schools before college, different states have different rules. So we're seeing, for example, in New Jersey, Governor Murphy mandated masks for everyone, vaccinated, unvaccinated, throughout the school system. We are seeing states where if you mandate a mask, you somehow lose your privileges as a school or a school board. So there's, as Marina and I have talked about in the past, you know, there's some interjection of politics into healthcare and healthcare policy, which seems a bit counterintuitive. So we're going to talk to our guests who are not only an amazing pediatrician, an amazing school nurse, but also very involved with the public health aspect. If you are interested in this subject, know people who are interested in the subject, please like and share and tag your friends who might be interested. We are live on Facebook, on Twitter, on YouTube, on LinkedIn at Sri Srinivasan's page. And we are, if you watch us live, you're going to be able to send in questions and comments, and we're happy to take as many of them as we can get to.
But we are sadly going to keep talking about COVID. So let's just do some updates. There have been worldwide 210 million cases and 4.5 million deaths. And there are currently over 17.5 million people who have an active infection with SARS-CoV-2. Most of them, though, thankfully, have mild disease, and only about 0.6% have serious or critical levels, in giving them severe disease So that is a good thing. And you can see from this slide which countries have, this is actually the other slide, is the global vaccine tracker. So you can see that the US overall is about 50%. Australia is actually 27% or close to 30% for fully vaccinated and over 40% for single dose vaccine. And you can see that Israel and UK are much higher at closer to 60 to 70% vaccination. So that, I think, is going to make a difference, right, for people, because as you have heard so many times, the reason we have the Delta variant is because the virus doesn't mutate outside a human host. It mutates inside a human host. So if people are vaccinated, there's less chance of this mutation occurring. Although it is true, though, you can be vaccinated and still catch the COVID infection again. But usually when you're vaccinated and you get it, it's much less severe.
Right. And I think that's the important part. It is a global pandemic. You saw that, much of Africa is not vaccinated at all. So we really do need to work on vaccinating the entire world. But let's look to our own backyard. So in the United States, you can see that the hotspots for COVID, which are in the South and the Southeast, absolutely match the places where vaccination rates are the lowest. So unfortunately, we have passed over 625,000 total deaths in this country from COVID, and we are seeing an increase to over 1,100 new cases per day. ICUs are at capacity across much of the South and Southeast, and that's because not only are there no beds, but there is no staff, there's no nurses. And I have to say that it is so difficult to take care of these people who were otherwise healthy, who then got COVID and are now sick as anything. COVID is caused by SARS-CoV-2, which is severe acute respiratory syndrome coronavirus 2. That's what that acronym is. And that really takes out your lungs when it's severe. And so these people are ventilator dependent when they're very sick, very disheartening for everyone, of course. But that also means that in those areas where ICU beds are capacity, if you happen to have a stroke or a heart attack or get into a car crash, you may not be able to get care anywhere near where you are. And you may end up having to be airlifted hundreds of miles away. We're seeing that in Dallas, where people are ending up being airlifted up to Oklahoma because the beds are full. So the reason to get vaccinated, and I know we're beating a dead horse sometimes, but how about we beat some life back into our society, is to prevent the transformation into these mutations that are more severe, and to prevent overrunning hospitals like this so that we can just get back to living a normal life.
And most of the data showing right now that the majority of the COVID infections in the US are the Delta variant. So
right.
And most of the vaccines, at least the vaccines we have here, have some efficacy against the Delta variant, right? So it's the Delta variant is way more infectious, as you can see from our graphic on the screen left. That originally you might, if you had it and you weren't masked and whatever, you were able to transmit it. It might be 2 people, but this Delta variant is more than 2 times as infectious, and you give it to more people. So that's of concern. But again, if people are vaccinated, there's a little bit less of a chance that you're going to give it to other people. And I think the biggest issue, which is what we're going to ultimately talk to our guest today about, is that if I'm vaccinated and everyone in my family is vaccinated, and my niece comes over who is not vaccinated because she's not eligible to get the vaccine, that it'll be less likely for any one of us to infect her with the COVID infection.
Yeah, our first president of the American Academy of Pediatrics guest, Dr. Sally Goza, said, wearing is caring, right? So wearing a mask, getting vaccinated is caring about others. Good news in New York City, not New York City, good news in the United States is that the vaccines, which were first approved December 11th, 2020 under emergency use authorization, the first one that was approved was the Pfizer-BioNTech vaccine, is expected to achieve full approval. So not as an emergency use, but full Food and Drug Administration approval either tomorrow or the next day. So, Marina, as you're putting away your white shoes as Labor Day approaches, you can also put away one of those excuses for not getting vaccinated.
That's so funny. But listen, guess what? You could still wear white after Labor Day. They're trying to debunk that. So.
That's true. That's true.
Right.
We really encourage you to educate yourselves and to get vaccinated. And if you know people who are not vaccinated, please encourage them to get vaccinated. Let's bring on our guests, Marina.
Yeah, absolutely. So we're really excited to have Dr. Michelle Fiscus join us again. She's a board member of the American Academy of Pediatrics and recently was the Tennessee Vaccine Preventable Diseases and Immunization Program Medical Director, and Linda Mendonca, who is the president of the National Association of School Nurses. She's based in Rhode Island and is an assistant professor of community and public health nursing at the Rhode Island College of Nursing. Welcome. Thank you so much for taking the time to join us, because as you guys are being inundated, but all of us are, facing what we do with our kids and going back to school. So this couldn't be more timely. And we, again, thank you so much for joining us.
Good to be here.
So welcome. And again, as Marina said, this is such a timely moment to have the two of you on to share your expertise and your experience. Linda, school nursing is challenging, and I think August is always ramp up time. What's different this year than it was last year at this time? And then, of course, in the pre-pandemic years, how are school nurses preparing differently this year?
Well, since the start of the pandemic, really, school nurses have played a vital role in helping school districts to navigate through this pandemic. By being at the table, developing and implementing plans. They've looked at, federal and state guidance and local guidance, looking at their particular school communities and what works best. And so they've really been there at the forefront to help to spread, to stop the spread of COVID within the school. It is challenging, but they're up for it again, this coming school year. So looking at the infection control protocols and the mitigation strategies and making sure that all of those things, are in place for this coming school year.
Thank you. That's really, so important to, have a national presence really in that space to give guidance so that, the states can look to it and also the federal government can look to it, because you guys really are on the ground, and you're the ones who are trying to manage this within your school district, and within your state. So I think it's so critical and very important. Shelley, I have a question for you about being in that position at a state level, and were you in that position before the pandemic, but also then for the past year and 3 quarters, right? When it first started coming out in January of 2020, and then throughout this entire past year, just getting the data, because it was constantly changing. I think that's why there's a lot of, misgivings about what we tell people, because we've said one thing, and when I say we, it's a royal we, I guess, and between the CDC and many of the medical groups, because what we knew then is completely not 180 degrees different, but we're on this journey and the road turns a little bit, you know, and then we come back to almost center and then it turns again. And so there's been a lot of data that's come out, information that helps guide what it is that we say to the public and to lay people in terms of what they have to do. So I can't imagine what that was like. I'd love to hear from you, Shelley, how that all panned out.
It has been a very, very challenging time for sure. You know, at the beginning of the pandemic, we were literally having changes in information and data multiple times a day from, you know, even on the federal level. And so it's understandable that a lot of folks are confused. It's hard for us to keep up with all of the information every single day. But we have, you know, had a lot of challenges around dispelling misinformation, around trying to get people to understand, especially in southern states like mine, how important it is to get vaccinated, how important it is to also wear a mask and distance and wash your hands, because, you know, this is really layers of prevention that we're trying to get people to adopt, to try to keep them healthy. And you know, moving back into what is now our third week in school here in Tennessee for most of our students, we're already seeing so much disease in children, infections in children, the need for some of our schools to be closing down already just a couple, 3 weeks into all of this. So it has been an extraordinarily challenging time. To your first question, we were not in this pandemic when I first came into the role, but we were in a multi-state hepatitis A outbreak, and then went into a measles outbreak, and then came into COVID. So we've been in some kind of outbreak ever since I had come into the position.
So, you know, right. So it's not like the crises ever stop or allow anybody to take a break, right? We have people watching from all over. I want to give a little shout out to the people who have checked in. We have Shinny Sam, Jan Ressler, Neil Parekh, who's watching from Northern Virginia, Michelle Raphael, who's watching from LA. Good early morning to you, Michelle. Thank you for watching. We have Ellen Austin and Miriam Berkeley and Makran Boot watching as well. Thank you guys for your ongoing support. Professor Sami Arze, I think, has a question. Is it safe with all this Delta variant going around to send children back to school? And I think that's sort of the crux of this conversation. So maybe, Shelley, I'm going to ask you to answer the professor's question.
You know, I think if we are able to put as many of those mitigation strategies in place as we can, that we can send kids to school safely. Obviously, we want every child age 12 and older to be vaccinated to protect them, but everyone in schools needs to be wearing a mask. The staff and teachers need to be vaccinated and wearing masks. We need to have them spaced as much as we can. We need to be careful about lunchtime and, you know, times when they would have their masks off, when they would be inside in close quarters with one another. And we have to make sure that kids are staying home and staff are staying home if they're not feeling well or if they've been exposed. And, you know, we're not seeing that happening as it should. And so unless all of those mitigation strategies are in place all at the same time to really optimize that safety, I do think it's very challenging to have kids in school.
You know, a lot of that is we have to get the socialization of kids back, right, Linda? I mean, you know, from a standpoint of learning and being, you know, first of all, I thankfully did not have to homeschool my kids. They were older enough that they were just able to study when we were all in quarantine mode. But it's so important for children to be in that school environment and in person. And that's what a lot of the studies are showing, that there's actually a drop back in kids' education, which the pandemic has really caused because of the whole remote learning that we've done. So with that in mind, getting kids back into school and in person has to be really the biggest focus, I think, for all of us. And Linda, you know, to ask the question again. I mean, I know that you guys have guidance behind that, but the best mitigation strategies that Shelley was just talking about, what do you guys feel are like the top 4 things that we can do when the kids do go back?
Right. So absolutely, mitigation strategies are key to making it a safe environment to return to school. I think that, like I said earlier, school nurses have been doing this for the past, 18 months. We're actually going into our 3rd school year with, living in this pandemic. So I would say the key strategies would be, the wearing a mask, being vaccinated, also, practicing the hand hygiene in school, social distancing. Testing is a strategy that's going to be used in schools a little bit more probably this school year with the CDC ELC grants that have been pushed out to the states, and they're working with strategies to provide testing in schools. So that might be identifying somebody right away that they are COVID positive and getting them out of the school environment. So many of these strategies are being implemented. And also having, the infection control protocols in the nurse's office or health center within the school, having the isolation room. So these things have been in place last school year, and they will be again this school year. It is important that we are back in school in person for students, for their mental health needs, socialization, social emotional learning resources are being implemented in schools. We've been dealing with this pandemic, all of us, right? I think our own mental health needs need to be in check, right? So it's important.
I think you make such valid points because we obviously care about the children's emotional, mental, physical health, their education. Teachers have suffered, faculty, staff have suffered. It's been a really rough road for the whole community. And what you alluded to is sometimes called the Swiss cheese approach. And I want to talk about that in a few minutes, but let's debunk some notions about masks maybe, because I can't believe that we started talking about masks in February or March of 2020 and we're still talking about masks. So Marina and I are surgeons. Like, you would never expect your surgeon not to wear a mask when they were operating on you. Like, that's crazy. Why do we wear a mask? It's because we don't want to breathe whatever germs we have into your wound. Like, we wear a mask so that we protect you. And we know that if you wear a mask and if you have COVID, your jet stream of COVID particles that can infect people around you, if you're wearing a mask, is much, 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 much less. And if the person you're talking to is also wearing a mask, essentially it's 0. And you can see that on this graphic, both with the cartoon people coughing at each other and with the yellow and blue bar graph, where you are the safest if you're wearing a mask and the other person is wearing a mask. And the American Academy of Pediatrics came out with a statement regarding masks that I think was very strong. And then on their Healthy Kids website, they've come out with some statements on questions that parents have about masks. So maybe, Julia, we can put up the blue slide of the American Academy of Pediatrics mask guidance, and then we can talk about these questions. So here, the Academy says, let's prioritize kids getting back into schools and make sure that it happens safely. And then in their Healthy Kids website, they have these questions about masks that maybe you guys can address directly. And I'm just going to read them aloud for people who might be listening and not watching the slides. Masks work to reduce the spread of COVID. They're a vital part of keeping kids safe. Children with special healthcare needs can safely wear masks with extra precautions, and they do not compromise children's breathing. So maybe, Shelley, can you comment about this for us?
Sure. There's a lot of hyperbole around masks. We hear, oh, what if my child sneezes into a mask? They're going to have snot on their face all day, or they're going to drop it on the floor and it's going to be dirty. Or, the really ridiculous ones about my child can't get oxygen, or my child is breathing their own carbon dioxide. So, if you're concerned about your child's mask being clean, then it would make sense to send more than one mask to school with your child, because they are going to drop them on the floor, or maybe sneeze into one, and so they should have a backup. And then those masks need to be laundered every day before they're put back on, so that we do avoid rashes and acne because of masks and all of that. But no child has died from a rash on their face or from acne on their face. But there are children who have died from COVID-19, and we want to make sure that we're preventing that as much as we can. The masks are, as you said, that is one of a number of very important strategies. And, to be clear, none of these are 100%. Masks are not 100%. Vaccines are not 100%. Distancing is not 100%. Hand hygiene is not 100%. But when you do all of those things, you make it less and less likely that virus is actually going to get to you in enough of a load to actually be able to infect you.
So we have a graphic for that. You had made a reference, Sujana, to it, the Swiss cheese kind of slide showing how this, if you have these different layers of processes, right? Like, so physical distancing's one, hand washing's another, and that as you go through, you can see how when the holes line up, but then because you're doing certain things, that transmission is decreased, and so that you have safety at the other end. So there's personal responsibilities and shared responsibilities, which I think this is a great graphic, and you guys can grab a screenshot to look at later. But I think this is a really great way of looking at how we can mitigate, as we've said so many times already, the transmission of this virus.
There are people who are very concerned that if children wear masks, they won't acquire speech and language properly. They won't be able to read emotions. I was talking to Marina earlier this week, and I said, we're in the OR and just our eyes are showing, and often behind protective eyewear. And we're pretty sure we can read emotions that are going on in that room. So the humans use lots of different cues to understand each other. And there's a really interesting article by a prominent research psychologist this week that talked about, her premise was that, in fact, wearing masks during this time is helping children be better learners. And her premise was that we really do learn a lot that's not related to just our faces. And we know there's data that we don't delay speech and language development, but she was saying, her name is Judith Danovich, and she was saying that masks may actually center the child more, focus the child more, allow them to constantly live compassionate living for others. And one of our producers, Rose, said, "What about kids who have speech and language delay?" And when I talk to patients who are hard of hearing or deaf, I actually use a clear mask so that they can actually read my lips. And certainly that can be done in those circumstances. But what do you think about this concept of masks and masks impairing learning, Shelley?
Well, I think it's really important to point out that the majority of speech development with children occurs at home. And so in most cases, there aren't going to be masks worn in the home unless someone happens to be infectious at that particular time. So by the time kids get to school or even preschool, where they might be in a learning environment where masks are being worn, though that foundation of speech and language is already hardwired by that point. And then I agree with you. You know, it's interesting. We don't learn from each other by watching each other's mouths, and it's one of the things that characterizes autism is that children who are autistic don't make eye contact with the people that they're interacting with. They might look at their mouth and watch their mouth move, but they don't make eye contact. Most of the time, typical developing children are watching our eyes and not watching our mouths when we're speaking. So you're exactly right. You know, wearing a clear mask if there's a child with an identified expressive or receptive language disorder, you know, in speech therapy or maybe in aspects of their learning might be important. But there really isn't anything to support that adults wearing a mask around children who are learning are hampering their development of speech and language.
I have a question for Linda. You know, part of that whole slide on Swiss cheese was that the schools would be doing better filtration with HEPA filters. Is that something that you know to be accurate, that schools are doing that to try and maximize the safety of the kids?
Absolutely. Ventilation is one of the strategies, right? And that's Swiss cheese. And so schools have looked at their HVAC systems and really made all the changes that they need to make sure that they have that 4 to 6 air exchanges per hour that is really required to provide that the ventilation needed for people to be in a space safely. So there's been funding that has come in through with COVID funds, et cetera, that schools have provided HEPA filters into classrooms. And actually here in my state, in Rhode Island, a year ago, we actually inspected the 306 public and charter schools here in Rhode Island to make sure that, the ventilation and other strategies were in place for a safe reopening last school year. So it's something that schools need to and should be constantly monitoring and maintaining, the ventilation in their school, because it's key.
I, for one, am totally glad. I'm sure people who are watching, again, and if you are watching on either YouTube or Twitter or LinkedIn, please do share. If you think this is a valuable conversation, share and tweet about it with your friends. But Suj and I both went to Stuyvesant High School a couple of years apart. But, I can still vividly remember those summer days where there was no air. You might be able to open the window or crack, and then you had to climb the stairs, 5 flights, all this. I know I suffered so badly, but no, I'm kidding. But that it was so arid. And then when my kids were young, they'd be like, "Oh, that part of the school that they go to, much newer school, it's like so hot up there." So I'm just thrilled that all across the country they are addressing that stillness and staleness of the air by having these filters come in. So I, for one, kudos to all the schools, because we all suffered. I guess you guys can all remember those times. It was quite dreadful.
It was, and I remember the fear of opening windows on a higher level because kids are stupid, right? So you can't just have open windows everywhere without bars. We have a really interesting question from Rick Deutsch. Thank you for watching, Rick. His question is it safe for kids to do PE and eat just 3 feet apart? Like, what is the safety? This is all that Swiss cheese, right? What are the safety measures for kids to be doing these also very necessary activities in school? And maybe I'll ask Linda that, because I have another question that came in for Shelley.
Sure. So really, it's important that we need to use our spaces in our schools as much as we can, especially bringing everyone back in person. So food service and school meals is key, but really doing it safely. So, wearing the mask, except for when you're eating, is what we're asking. The food service people, the staff should be wearing their mask at all times during meal preparation and serving. Students need to keep their mask on while they're moving through the lunch line to, to get their food, and to really try to, maximize that physical distance as much as possible, going through the line, and then trying to sit, as, feasible as you can, the 3 feet apart, and, making sure that ventilation, again, we're back to ventilation, but making sure that that is adequate in that space where they're eating, if it's in the cafeteria. Many students did eat in the classroom last year. So there may be some schools who will continue with that, but if they're using a large space, it's important that masks are wearing, all the time, except for when they're actually eating their food. PE, physical education classes, it's really important to as much as possible, try to do those outdoors if you can. But as we know, the weather and so on doesn't always dictate to that. But outside is always best for any activity that we can. But if you're indoors, again, it's maintaining that space, mask wearing is important. So if it's an activity that they can be wearing a mask, that's also been something with sports around mask wearing. I know it's different guidance around the country, but thinking about all these measures when you're coming up with your plan for your particular school community.
Thank you so much, Linda. There's a lot of concern about what to do with children when they are quarantined from school. So, Shelley, you were mentioning that there were some huge outbursts of cases in Nashville. About 1,000 children and teachers were sent home for testing positive for COVID within that first week of school. We're unfortunately seeing that across the South and the Southeast. We had South Carolina, it's a rapidly evolving crisis. Texas first had a ban on masks, and then after a lot of hue and cry, I believe that ban on wearing masks in school was lifted, which I believe is an excellent choice by the legislature to promote school health. The question that we have coming in is from a grandmother who asks, if my grandchild is quarantined from school and the grandmother is vaccinated, can the grandchild be left with the grandparent who is vaccinated after either exposure or testing positive? And what measures should be exercised in the home? And I really like this question because it delves right into the weeds of real life.
Yeah, it doesn't, with young children, they have to have an adult caring for them. And so, what you need to do is put in as many of those mitigation strategies as you can. So, let's just define isolation versus quarantine real quick. So if someone is in isolation, it means that they are a confirmed case. They have been infected with the SARS-CoV-2 virus and they are infectious. And so they are isolated. If you're in quarantine, that means that you were within a space or a length of time with someone who was infected, but you yourself are still healthy. You don't have any symptoms, and you have not had a positive test for the virus. So if the grandchild is in quarantine, that means that grandchild is healthy, but has been exposed and could potentially be incubating that virus. So if there is no choice but to have that child cared for in your home, it's great that you're vaccinated. That's the first thing that you needed to do. I would go ahead and wear a mask when you are within close proximity to that child, just because there is a chance that she would be incubating that virus. Also have the child wearing a mask when they're outside of their quarantine space. And then wherever you can, that child should be in a space that is, where they're really by themselves, certainly not within 6 feet of anyone else who might be susceptible to getting infected, in order to keep you all as safe as we can.
That's great. So, I'm glad that our viewers are watching and giving such great questions and stuff. And, these measures are so critical to the safety going forward. And, I'm thinking of college, right, where we have much less structure for our kids and what they're planning on doing, et cetera. There is a mandate, right, about teachers getting vaccinated, which has brought up a lot of issues amongst the teachers union. And we know that Randy Weingarten, I believe it's Weingarten, right, had said that she encouraged all teachers to get vaccinated. What we are also not thinking about, which is also so important, and Linda, perhaps you can address that, is the mental health of our teachers and their well-being. And I think when we were talking the other day, Sujana, we were talking about people who are like, hey, I didn't sign up to be thrown in the line of fire, right? Like there were so many different professions that were like, well, I didn't sign up for this, or I didn't sign up for that. And actually, in actuality, we all did, because we were all providing such a critical service to the community, whether it's for, it's sanitation, to grocery store, to pharmacy, to hospitals, to our police and our fire department. Like every aspect of what we do in trying to keep our communities together is something that ultimately puts all of us in the if you will say the line of fire, or in some danger related to the pandemic as we're seeing now. So Linda, the question I have, sorry, that was a lot. I was so emotional.
It was great though. We were like, yes.
But yes, go. But what about the teachers and their emotional health? And also when there's pushback, how are the different communities going to, or school boards going to deal with pushback for vaccination? Because there are, just as in healthcare, there are healthcare workers that feel that it's not time yet to take the vaccine, which
Right.
I was like, I'm a guinea pig. Let's go. Give it to me, but anyway.
Yeah, no, you're right. It's and as you know, the vaccination is a public health strategy, and it's what we support as public health workers. And I think that we want our school communities to be as safe as possible and have all the eligible people, students and staff, to be vaccinated to make the school environment as safe as we can. So it is a difficult situation. I think that school communities are looking at this on a local basis. Many states, some states have maybe mandated that, but many states have not. So it is a concern. And I think that as much as school nurses, promote it, we will educate our school communities and really try to make sure that they have the accurate information and not the misinformation about the vaccine, and really try to get that message across. The mental health of our teachers and faculty is crucial. We need everybody to feel safe and to be feeling good about where they are and what they're doing. And so again, back to mental health, we need to make sure that we are addressing that and providing those resources that are necessary for our school communities to make it a safe place and a place where everybody wants to be, and we can continue with our learning.
So thank you. I agree with you, and I think before the pandemic, we had Teacher Appreciation Day and Teacher Appreciation Breakfast, and I think if the four of us don't owe a debt of gratitude to the wonderful teachers in our past, I don't know who does. But I think, as you said, making it safe so that they can do what they're trained to do is really very, very important. It's very important that we understand that schools are a vital part of our community. And I think Marina put that really well. It's like Sesame Street, right? These are the people in your neighborhood. So these are the people we're supposed to care about. Very interestingly, STAT surveyed a number of infectious disease experts and asked them a series of questions. And all of them said that they would not send their unvaccinated children to school without a mask. And most of them said they would not send their vaccinated teen to school without a mask. So Shelley, we have a question from, oh, I'm sorry, it's somebody, Shamala Devi, I think, who asks about, the question that we have all heard about how safe it is for children to wear a mask day in and day out. So maybe you can explain to us why infectious disease experts who really do understand SARS-CoV-2 better than even the four of us on this show, why they are talking about masking their children 8 to 10 hours a day, and why it is safe for children to wear masks.
Yeah, carbon dioxide is not toxic. So I think that's the first thing to talk about is that, carbon dioxide is a gas that we expel out of our lungs, but, this is something that the body produces. It's not toxic to us. Yes, we don't want it in excessive amounts, but when you are wearing a mask, again, as Sujana, you had brought up, we have surgeons that wear masks day in and day out for hours and hours at a time in operating rooms, and they're not falling over because of carbon dioxide levels being too high. So that is really not a concern. We don't have masks that are made out of plastic bags that are not permeable. These are not masks that fit tightly to the face. There is plenty of air exchange around them, but what they do provide is a barrier for those particles that are coming at you, those droplets that are coming from someone who's coughing or speaking or singing. And those droplets are fairly large. And so they get stopped by the weave of the fabric in most cases. So there are several infectious disease experts that I've heard say, if they had to choose between getting vaccinated and never having a mask, or having a mask and never being able to be vaccinated, they would choose the mask. And we know now that vaccinated people can get the virus in their nose and their airway, that they can have that virus there, that they can transmit to other people. And so that mask, again, not only protects you from getting large quantities of that virus in your nose where it can make you sick, but also protects you from unknowingly spreading that virus to the people that are around you. So we're not at all concerned. That the American Academy of Pediatrics is not concerned about masks in children and them being anything but something that's going to help protect them from the people around them who could pass them that virus.
Can I just add really quick too? Last school year, I did several site visits in schools, and children are resilient. They had their masks on. They weren't complaining. Maybe they might have, went down. The teacher would remind them to put it back up, but they were wearing their masks without any problem, from what I observed.
Shelley, thank you for that, Linda. Shelley, can you discuss why we are seeing more children getting sick from the Delta variant now? Why is it different than the other COVID? Why are the kids now who, before in the first wave of the pandemic, they might get it, but they were completely asymptomatic or had like a mild cough, maybe a fever. But now we're seeing the kids get super sick, and it's like the virus is thumbing its nose at us, right? Like I think in the US, we did a reasonable job of rolling out the vaccine and getting it to different groups in the order we thought was important. And now the variant's like, oh, you didn't get the kids? I'm going to help. I'm going to do something here, which is so dreadful, right? But why are kids getting so much more sick and filling up to some degree the pediatric ICUs?
Yeah, we knew this would happen. When you have that population that is still vulnerable, viruses are really good at mutating, and so they see that opportunity to be able to infect a different kind of host, and so then these mutations happen, and it's survival of the fittest amongst these viruses to see who they can infect. And you're right. Beginning of the pandemic, we didn't really see kids getting sick all that often. Now, we still had 4 million cases, so I don't want to minimize the number of children that had been infected with the virus. But they weren't becoming as sick as what we're seeing now. Really, what we see now is that this Delta variant is so much more transmissible. So, the first a person who's infected might infect maybe one or two, maybe three other people. Now we're seeing one person who's infected maybe infecting 5, 6, 7 other people. And so what we're seeing with pediatric hospitalizations and intensive care unit stays is really a result of just the huge number of children who are now becoming infected. And really what we've set up in southern states like mine, where masks are not encouraged, where masks are sometimes discouraged in schools, where we have very low vaccination rates, around 40% in the state, where we still don't have vaccines across the world that are approved for children under 12. You see these very large numbers of children getting infected, and so the percentage of kids who are getting very ill is about the same, but the number has grown. So we're seeing more and more hospitalizations, more ICU admissions. The other thing that we haven't talked about is a condition called multisystem inflammatory syndrome in children, which is an unfortunate consequence of what is sometimes an asymptomatic infection, where children get infected, maybe have no symptoms at all, and then maybe 3-4 weeks later develop severe organ system compromise. They get heart conditions. They have problems with their breathing, their kidneys shut down. These kids go into the intensive care units and need to be ventilated, need to be on dialysis. Most of them do survive, but it's a very, very serious illness. Tennessee and some of the southern states have some of the highest case counts of that disease because we don't have good mitigation strategies in place in our schools.
So I think, it breaks your heart, right? It breaks your heart as a healthcare worker that this is a really largely preventable transmission, largely preventable. As Linda said, I have a little, I guess she's a grandniece who is just 2 or 3 years old. And man, that girl wears a mask like nobody's business, right? She has no issue with it. She puts on her dress, she puts on her mask, she's good to go, right? And I think these are really just preventable conditions. When you hear of children in the intensive care unit, we haven't even talked about what's going to be long COVID in children because we just don't know yet. But I think that's something, unfortunately, we have to look at. August is National Immunization Awareness Month. COVID is not, as you mentioned, there was hepatitis A, there's been chickenpox outbreaks, there's been measles outbreaks. So there is a reason that the vaccine schedule in the normal course of events is set out. And we hear about parents trying to either avoid these common vaccines. So I'm very grateful that I have not had polio or smallpox or measles. I think I did get mumps, and I definitely got chickenpox, right? Because I'm too old. There's a reason we roll out these vaccines in a certain order and a certain time frame for children. Can you talk to us about, Shelley, about the dangers of changing, or is there a danger to changing those regimens? And then Linda, maybe you can chime in as to the school nurse's role in ensuring vaccination for other illnesses. So Shelley, I'm going to ask you first.
Yeah, so we think we have a problem with SARS-CoV-2 and COVID right now. Measles is 2 to 3 times more infectious than this Delta variant. So if we were to have an outbreak on the scale of what we're seeing with COVID, but with measles, it would just be a runaway train. And so we have these very effective, very safe vaccines that we've had for decades that are available and should be widely used as a prevention measure. And most states have school rules in place that require children to have these vaccines, because we know that most of these viruses are still circulating among us. There's measles virus around there. The reason we're not seeing outbreaks is because the vast majority of us have been vaccinated against measles. The reason we're still seeing COVID running around is because the vast majority of us have not been vaccinated against COVID, including all of our children under the age of 12. So these rules are in place to protect the good of everyone. We certainly don't want measles outbreaks coming in and closing our schools. The side effects from measles include having, in some cases, encephalitis, which is a brain infection for children. About 1 in 1,000 cases have that. About 1 in 1,000 kids who get measles will die from measles. So it's very important that we're keeping up with the routine vaccinations that have been approved by the CDC and the Advisory Committee on Immunization Practices and by the American Academy of Pediatrics to keep all of these other diseases out while we're still dealing with COVID, and to also remember that we have a pretty effective flu vaccine, and that we know that kids who get flu vaccines are extremely unlikely to die from influenza. So flu vaccines should be coming into grocery stores and doctor's offices around you over the next few weeks. Don't forget to go get them vaccinated against flu, because we don't want to see children die from influenza this year, just like we don't want to see them die from any of these other preventable diseases.
Thank you. And Linda, what do you do as a school nurse in terms of vaccine?
Right. So, school nurses, it's a major part of their role as gatekeepers, making sure that all students have the required immunizations to enter school. And they also maintain their school records. And they are a trusted member of the school community. I say the school nurse is the heart of the school community, and they develop trust and relationships with students and families over the years and use those evidence-based strategies really to make sure that, all those immunizations are up to date by having school-located vaccine clinics or looking into the state registry to see what students might be missing to make sure that they do have accurate records. So they have, communications with families to let them know. And they, like I said earlier, they educate people around the vaccines and the reasons for why they need to have them.
So, we have a couple minutes left. We want to get 3 takeaways at least from you guys. So let's start with Linda. Linda, what are your 3 takeaways for our viewers?
Okay, thanks. So I guess my first takeaway would be to make sure that that the school nurse is there. She's the essential person in the school community with public health expertise, and making sure that there is a school nurse to make sure that the school environment is healthy and safe. And then second, back to the masking and vaccination. We know there are public health strategies and that we all should be doing that to make the school environment safe. And lastly, we need to work together as a team, the school community, and the school administrators, the health departments, the school nurses, parents. We need to work together as a team and collaborate to provide a healthy and safe environment.
Thank you. And Shelley, Dr. Fiscus?
There isn't a parent around who doesn't want to do the very best thing that they can do to protect their child. And the very best thing that you can do as a parent is to get them vaccinated if they are age 12 and older, to vaccinate the people around them who are eligible if they're under the age of 12 and can't be vaccinated yet, and to make sure that everyone is wearing a mask when they go out into public, whether that's in school, in a grocery store, on the school bus, in the shopping mall. Everyone needs to wear a mask. That, again, it's that layered strategy, that Swiss cheese thing where if you wear a mask, if you get vaccinated, if you keep your distance, if you stay home when you're sick and you get tested, then that's the thing that we need to do and all work together to make sure that our kids can stay in school where they need to be in person and learning and getting everything that they can out of that experience.
Thank you both so much. So many pearls of wisdom were dropped this hour. Thank you, thank you, thank you. I'm going to go back and watch the show so I can relearn what you guys said. We really appreciate you being on. Dr. Michelle Fiscus, board member of the American Academy of Pediatrics, and until recently, the Tennessee Vaccine Preventable Diseases and Immunization Program Medical Director, and Dr. Linda Mendonca, who is the president of the National Association of School Nurses and assistant professor of community and public health nursing at the Rhode Island the Rhode Island College School of Nursing. We want to thank our team for putting this show together as they do for all of our shows. Marina, we have a little bit of summer left.
Yeah, we do. So enjoy the rest of your summer, and we're going to be back the Sunday after Labor Day with a great show for you guys. So we look forward to talking to you then.
Stay safe, mask up, get vaccinated.